everybody. Thank you for joining us. So appreciative of you participating in the Scottsdale Area Chamber of Commerce podcast. Today, we've got a wonderful presentation for you. We've got two very extraordinary guests that are at the forefront of innovation in dental industry and very deeply connected into the community. We're very grateful to welcome Dr. Oksana and Dr. Alexander Hellge. Thank you for being here with Advanced Care Dentistry and a great and valued partner with the Chamber. Appreciate you being on board today. We've got some questions to talk about your backgrounds and the amazing work that you're doing, both in terms of the dental practice. Dr. Oksana is an expert in tissue engineering and aesthetic dentistry with a passion for using non-chemical, natural treatments to enhance patient care, which is wonderful. We're excited to hear about that. And then Dr. Alexander, you've been a pioneer in the space of laser dentistry and implantology, which I'm excited to hear a little bit more about that. Most of all, you care for your patients so much, you care for the industry, and you're both world-renowned leaders, experts in the field of dentistry and what you're bringing to your practice in Scottsdale. To lead off, let's just get a little overview of the practice and your backgrounds and what the practice is focused on right now.
So we started Advanced Care Dentistry last year. Found a great location right on Market Street. Great location. We're very, very happy with that. And we started it as a takeover of an existing office which did no longer exist, and we branded it. And based on our combined experience teaching, and my wife has been teaching in Texas A&M for 18 years. I have been at Midwestern University for 15 years. Prior to that, I was teaching at University of Southern California, and prior to that, I was for several decades in private practice. And we took all our combined experiences and knowledge of advanced technology, did a brainstorming and said to ourselves, what would it be? What would our patients benefit the most? What technology should we incorporate into that office? What works as evidence-based dentistry taught at the university level? And we decided on several advanced technology procedures and technologies which are definitely helping our patients, and we're very happy and pleased with our location.
Well, it's a great location. Dr. Oksana, a little bit about your background and some of your specialty.
I was in a private practice, and then after that I went to Israel and also finished dental school there, practiced in Israel as well, and came to the United States and got licensed here as well. So I was teaching in Texas A&M, it's previously called Baylor College of Dentistry in Dallas, Texas, for 18 years, and I was an expert in diagnostic sciences because my background is as a physician stomatologist. So my degree first as a medical doctor, and then I become a dentist. So this is our special kind of niche, and because teeth are attached to the head and to the body, so everything with the gum-associated conditions or any conditions that systemically we can see it in the patient's mouth. And because of this background, what I possess, it's very, I would not say easy, but it's very good combination to diagnose certain conditions that mouth can tell the story. So
Fascinating. Your backgrounds are fascinating, global in your experience, highly regarded with the institutions you represented. Burning question from the host here. Why Scottsdale? How did you wind up deciding to build the business in Scottsdale?
So I will start first because I moved to Arizona because I got married to this wonderful man. Otherwise, I would stay in Texas. And we chose Scottsdale also because we look for different locations. And suddenly this location appeared because we did pray. So, and it's actually helped. And this location appeared one of the most valuable for us. Plus, it's close to where we live. So we don't have to spend time to travel too long also to the location. In addition, because it's like in the middle of Scottsdale, we serve also Peoria, we serve Phoenix, like all location whenever people come, not just Scottsdale area in Cave Creek.
And just to add on here, after I finished my teaching engagement at the University of Southern California, I started with Midwestern University, and we actually built the dental school in Glendale. And so Scottsdale stuck out as an area where a lot of high-end businesses are residing, very discerning, let's say, customers, clientele, and patients. And for the services we offer, we want to offer the best services, and also, obviously, human nature, we also want to be appreciated for it. And we get this, with the clientele we have developed in our Scottsdale location. Great patients, very appreciative, and very nice to work with. And that just makes it a pleasure every day.
Well, clearly you picked the right location to initiate your valley-wide practice, but we're grateful for that. And we're known for a lot of things in Scottsdale and the Scottsdale area, but the number one thing is our smiles. And we want to make sure those smiles are working well and that we can flash them all the time. And thank you for helping protect our smiles and be part of the medical landscape for the Scottsdale area. In point of fact, a lot of economists talk about different sectors of different how industries. Right now, semiconductors is very topical, so you hear a lot about that. Tourism, you hear an awful lot about that in the Scottsdale area. But equal to all of those and a huge mainstay of the economy is healthcare. And dental healthcare is such an important part for that. So thank you for choosing Scottsdale and choosing the chamber. I just got curious. Who are the influencers for you? What guided you into this industry? How did some of those folks that may have given you direction or that you considered mentors, how did you get into this business in this practice area?
Starting with me, it's my father. Was a dentist, primarily focusing on saving teeth. He did a lot of gum tissue treatment, periodontal treatment, as it's called in our jargon. And one of my uncles was a cardiologist, and another one was an internal medicine specialist. And just sitting around and talking, and what I wanted to do, I came always back to dentistry. Obviously, dentistry was the topic of conversation, whether it was as breakfast, lunch, or dinner. And then ultimately, I was an exchange student in San Luis Obispo, spent my senior year in high school there. And my dad said, dentistry is a very tough profession. You have to deal with patients, you have to deal with employees, and every single day you have to focus on these small little details. And maybe you want to do something else. And I came back from my year in San Luis Obispo in California, and I said, Dad, I'm going to be a dentist. And then he said, however, now the landscape has changed. I don't want you to go to a dental school in Germany. If you can get into an American dental school, I want you to go to a dental school in the United States. And, long story short, I graduated from the University of Southern California and had an outstanding education before I started my residency of 2 years in Germany. And then the rest is history in terms of, having the passion. Other influencers for me in terms of dental and our profession, how it's going for us. One would be Professor Pascal Magnier from Switzerland. He is a world-renowned expert on minimally invasive dentistry. Again, reiterating what I already learned from my father, and that is, you have to save every little tooth, every little bit of tooth structure. You don't give it up. You save it for your patients. And Pascal Magnier, he expanded on that, and that's the philosophy we have in our office. We are saving teeth. We want to maintain our patients in perfect oral health, and then, as I call it, we are getting you out of the repair shop. We are having you now in the maintenance department, Maintenance department is a whole lot more fun, and you're also going to preserve what you have and what you invested in your oral health. Another influencer for us, both of us, is Professor Myron, also from Switzerland. He is the #1 researcher in platelet-rich fibrin, which is reconstructive medicine. And that has been an absolute game changer when it comes to dentistry and also facial aesthetics.
Dr. Oksana?
So with this, like to continue with the PRF, this is platelet-rich fibrin, what we do right now, it's not just medicine. It is regenerative. Also, we used for dentistry as well. And you can do it after extraction. It's with the bone graft, the healing potential is amazing. Periodontal surgeries and of course facial aesthetics. We use it now very frequently. And our laser as well. So when we start with the laser, immediately, I think it's the first purchase for dental office with the laser. We has a dual links, with the laser, and I'm doing root canals with the laser, which is American Academy of Endodontics, which I'm a part of it also. Published article. This is the best what you can get by doing root canal treatment with the irrigation with the laser. Yeah, it's called sweeps technique.
And just to expand on what is platelet-rich fibrin, because I'm sure the audience would like to know, where does it come from?
Yeah.
And actually our patients bring it because it's part of the human blood is platelet-rich fibrin. So we have a phlebotomist who draws the blood, we centrifuge it, and then we are getting all the growth factors in there. That's what platelet-rich fibrin is. Once we have separated the growth factors, we can now regenerate all the tissues because the patient's own blood is used. Nobody can be allergic to their own blood. So that being said, we are seeing healing, which is instead of 2 weeks, we are seeing the same result in 3 to 4 days, which is totally amazing. It's like I did the surgery, last week, and what happened? It should be like 2 weeks ago, the way the tissue looks. And in terms of regenerating, I'd also do a whole lot of implant rescue surgeries.
Yeah, I'm interested in that because I know that's one of the things that you specialize in and your background.
And so in terms of implants, some of the implants for a variety of reasons, they need some help to stay longer in the patient. So we are using laser technology and a combination with platelet-rich fibrin, the growth factors, to regrow the bone around the implants. And so we are regenerating the bone.
That's really breakthrough.
And we are regenerating the tissue to perfect health. It's not what we are doing, it's really just, the research which, we are grateful for that was done internationally to have the platelet-rich fibrin as a great adjunct to our proven therapies, and the outcomes are phenomenal.
Right.
And the testimony is with your patients, right? At the end of the day, that's what you're here for. I don't think many folks that go to see experts such as yourselves understand the incredible science and technology and research that has gone into the work that you're doing. There's something that I noticed that you've been doing a lot of work to address sleep apnea, which is, as we talked about, a pandemic. I mean, it's an issue, major issue. Tell me about how you're addressing sleep apnea.
So sleep apnea is now, unfortunately, a pandemic. The obstructive sleep apnea, as it is called, OSA, is usually not diagnosed. Patients have a slow onset. They just notice in the day I'm not as awake. I might fall asleep during the day or in the early afternoon. And I wake up at night just trying to get air. So they actually stop breathing at night. And depending on how many non-breathing episodes they have, that's the severity of the sleep apnea. Now we have to differentiate, is it central nervous system, is it primary or secondary sleep apnea, meaning does the patient have constricted nasal passages, deviated nasal septum, any kind of obstruction in the sinuses, or is it in the secondary airway system back behind the throat? And this is where a combination approach is necessary. First, a sleep apnea home study has to be conducted, which a physician then monitors and then gives us a diagnosis. Yes, we have obstructive sleep apnea of certain severity. We are working with physicians on that. Then we are coming in, how are we going to treat our patients, which is the most effective way? And if the obstructive sleep apnea is not so severe that only the CPAP machine is of help, we are coming in with oral appliances, which, to make the study short, it brings the lower jaw forward and opens up the airway and also opens up the bite. So at night, the airway going into the lungs is unobstructed. They are getting a better night's rest. And in men in particular, it often manifests itself in terms of the number of times they have to go to the bathroom.
Interesting.
Because the body does not go into a sleep mode, is constantly awake, so the urine production is not slowed down the way it should be when you are asleep. So now, oftentimes the poor prostate is blamed, and it might be a combination, but more than often it is actually the sleep apnea which is keeping the patient awake. Urine production continues, and then cortisol production is also greatly increased. It's a fight or flight trying to get air. It's very natural, and this is where also the grinding of the teeth is coming from. So when I first studied temporomandibular joint disorders in the 80s, I have to say, we always said, oh, Mark, you must be under a lot of stress. Your teeth are cracking and you're grinding your teeth. I'm going to give you a piece of plastic called a night guard, and that's it. We didn't understand that you're grinding your teeth not during the day. You're doing that at night when you don't have a feedback into your brain that you're actually doing it. And so you are destroying the hardest substance in the human body. It's called enamel. And oftentimes we see the results of sleep apnea, the long-standing sleep apnea, where the patients have destroyed their teeth, completely worn down. And then they also form additional bone, especially in the lower jaw, and we can tell there is an issue. And it used to be, yes, Mark, you're under a lot of stress. Well, today we have a completely different way of looking at it. Is there a sign of obstructive sleep apnea? And now, more than often, 98%, it is obstructive sleep apnea, which led to the event of grinding and destroying your own teeth. So that's the reason why we are screening all of our patients for any kind of early signs and symptoms of obstructive sleep apnea. One way of dealing with treating it after the physician has signed off on it is with an oral appliance, and then we are having another help here, which is called the laser. Over time, what is happening to all of us, gravity and laxity of tissue, the collagen is not of the same quality anymore. So when we sleep at night, especially on our backs, the tissue in the palate falls back and closes the airway even further. Now, we have an opportunity with our laser to tighten the tissue in the back of the throat. We are lifting it back up. We're rejuvenating it. Now, we have a dual approach. We're opening up the airway, if you will, manually with our appliance. And then secondarily, we are giving the patient back what the patient had decades ago, more airway space. And the goal is here that we are treating the patient as a whole. Like Oksana was saying, She comes heavily from the medical, side, and you have to see the patient as a whole. And then we go back and say, oh, there are teeth. And then, oh, that tooth or these teeth have issues. But first, we have to look at our patients comprehensively and work with any and all medical specialists as needed.
One more question tied to the practice. This seems like it's very breakthrough on a lot of fronts, especially with the laser. And I'm sure your patients, I know they appreciate it. How much time does it take to go through the apnea evaluation from the point of you do the different treatments? At what point would you go? How long from hello to laser? How long would that take?
For example, if patient's already been diagnosed with a sleep apnea or hypopnea, whatever they have and diagnosis, they can start treatment immediately. Yeah, we can do it immediately. And you have to have minimum 3 sessions of laser in order to kind of build upon collagen production, and also because it's a dual approach here, we use 2 different wavelengths of laser in order to start. First, we're gonna make a collagen softer in order to rebuild itself. And then we put a different, it's called erbium YAG, the second laser, into it, which is tighten the tissue. Same wavelengths we use in aesthetics, do also intraoral tissue to decrease wrinkles and fine lines, and to bring cheeks up instead of down, like what Alexandra was saying about gravity. So this is a part of the aesthetic
Yeah, I was
deal.
going to say, because that's part of
Yes,
your practice
yeah,
is the
yeah.
aesthetic side of it, and this falls into that.
Yeah, and sleep apnea, whatever Alexandra was mentioned, the laser, what we do for soft palate tightening, it's not just for it's also decrease bacterial load in this area. If people, for example, have large tonsils, suddenly the tonsil shrinks as well. So it's kind of dual approach as well. And for perform lays, like for cyclists, I have a bunch of people who are cycling. I'm myself cyclist. I love to cycle for long distances, 100 miles, and they want to have more air. We're gasping for the air. After 40 miles, I have to stop, and I have to stop. I said, okay, I need to have a little break too. So, and we can help those athletes as well with the tightening of the soft palate. Actually, the same erbium YAG laser with a different handpiece used in gynecology, to tighten vaginas. Yeah, this is one of the procedure that is actually also well known. We don't do it because we treat patient till that point, but this is the same laser technology.
Well, clearly the practice is forward-thinking. I know I don't believe I'm suffering from sleep apnea, but if I thought maybe I'd hang upside down on inversion boots like a vampire. But if people want to find out more and maybe address the sleep apnea or the aesthetics side, how are we going to find you?
Well, the advancedcaredentistry.org is our website.
advancedcaredentistry.org.
Correct. And then phone number is 623-223-8881.
Let's move away from the actual science and technology side for a moment. Let's talk a little bit about you two. Partners in life, partners in business, partners in your practice. What's the secret sauce?
It's so much fun to work together. So much fun because we have a different expertise, and every single case, now we start running on a large, big cases that last like several months. So we diagnosed, and after diagnosis, both of us look at the patient with a different perspective, and then we communicate with one another about treatment plan. And this is, I think, very beneficiary for the patients because I graduated, my dental school was 1990, my first dental schools. I had 3 total. And Alexandra also graduated a long time ago. And because we work in different countries, we see also different, for example, people like in Russia, they have longer roots, believe it or not, than
Really?
in Israel. Yeah. So, and it's Also, some documentation and also statistics is actually lead toward that. In addition, we noticed that people in humanitarian approach to the patients, it's never changed. People everywhere the same. So we have to treat patient first, the spirit, make sure they're comfortable, and both of us, because I'm more quiet person, I do things. Alexander like to talk to the people, so we can target everything. Yeah.
And talking about the secret sauce, I think right there, that is it, the two different areas of expertise. Oftentimes we have patients and it might be a root canal treatment, it might be a surgical extraction, and once it is clear, for example, it is a root canal treatment, I tell our patients, you're much better off, seeing my wife. She is the absolute expert in that. She loves it. If it were a surgical procedure, you would see me. And if it were going towards implant, certainly you would see me. I have placed my first implant in 1984. So I go way back, with implants and have gone through many, many systems. In our practice, we are using a specialized implant, which is what's called a shorter implant, which allows us to place it in more difficult spots. And in addition to that, it is the only system which is FDA approved, which has 100% bacterial seal between the component, which actually is seen in the oral cavity, and the actual implant. So we have a tremendous success, with that particular system. We have multiple systems, depending on, obviously, the patient's needs. Again, we are augmenting all of this here with, the growth factors derived from the patient's blood.
Which is fascinating.
And that gives us, a much faster integration. So we are, very fortunate that, we have had researchers around the world who came up with what is beneficial for our patients. It's all for the benefits of the patients. Okay, what is the best outcome, what we can achieve for you, and how can we get there? And this is the key. And if we need, physicians to help us out in the overall approach, treating, let's say, high blood pressure, treating diabetes, which are contributing factors to a decrease in life expectancy for implants, yes, we need to, utilize all resources before we just go in there and look at singularly at, we need an implant in that lower right side. Okay, that's the wrong approach. First, we need to look at the entire patient, medical history, medications, side effects of medications, and then we are talking about, okay, what is the issue at hand when it comes to the oral cavity?
So if I'm tracking properly, because you've got a lot of information, a lot of technology, you're bringing all that historical knowledge, experience. You found science and medicine. You found each other. And now you found Scottsdale. So all
Correct.
a good trajectory. Very, very grateful for that. I know you're very involved in different humanitarian efforts and activities. Of course, we're incredibly grateful for your membership in the Chamber and your involvement, and we love seeing your smiles at different Chamber events. Is there anything else you want to tell us about, maybe not the practice itself, but maybe some of your community or humanitarian efforts?
Yeah, if I can touch on one of the areas I was busy in, and that was Bosnia-Herzegovina. The German ambassador, he reached out to me when I still practiced in Germany, whether I could help rebuild the dental healthcare system in Bosnia-Herzegovina. And so I, visited, Sarajevo, and this was right after their civil war. There were still bullet holes in the buildings on Main Street. So, and the mines were not cleared yet by the American forces, so it was not the safest place at the time. I started working with the World Health Organization, and they did a very detailed study of what this country actually needs. And what came about was we have to send mobile units into the outlying areas. People don't have the means to get to Sarajevo to see anybody. And now comes what really influenced me, and that is we are, as dental professionals, the very first ones who are diagnosing high blood pressure. And so they said, in order to lower the overall healthcare costs for this country, which just is rebuilding, we need to look at two factors. One is high blood pressure, and one undiagnosed prediabetes or diabetes, all having major influences and factors in the oral cavity. And I took that approach, and this was in the late 80s, and I'm thinking that makes complete sense to me. So I really revamped my approach to also how I look at, our patients. Now, my wife, she has had the advantage of coming from medicine because that's her, primary. In Europe, you have to have medical school first, and then you specialize in dentistry. So this gives her the edge when it comes to like oral pathology, any kind of a general medical condition, and this is why it's beneficial for our patients to have us as a team because, we are complementing each other, and that's like you said, what is the secret sauce? That is the secret sauce, to complement and not duplicate services.
Well, clearly, working together has been a blessing for you, and I'm sure for your clients. Tell me again how we're going to find it. How are we going to find you?
Okay, at advancedcaredentistry.org.
Okay.
And the phone number is 623-223-8881.
All right, we're going to wrap up in a few minutes. Anything else you want to touch on before we wrap?
So we just recently also purchased a new machine for aesthetics that we can deliver PRF and fillers without even placing needles into the face.
Really?
Yeah, it's called Energet, and we do kinetic facelift with that device. Yes.
Really?
Yes.
All within the practice.
Always
All
in the
within the
practice. Yeah.
That's more of the aesthetics, so we appreciate that side of it. Wow, congratulations.
Thank you.
Congratulations.
Thank you very much.
Thank you for being our guest today on the Scottsdale Area Chamber of Commerce podcast. We greatly appreciate it. We'd like to learn more as we go along. I think the viewers and listeners can find you and talk to you, and I'm sure you do a lot of one-on-ones to talk about folks and their challenges. And I love the idea that the science to it and the fact that the actual the mouth kind of tells the story of where the whole body may be and what that is for better quality of life, better health care, and we're glad you're in Scottsdale and practicing. So thanks for joining us today. I want to thank our great production team at Star Worldwide for all the work you guys do. Robin, thank you. You and the
Thank you.
team. Dave Pratt, we love you. Thanks so much for being a partner with us. We know that Star Worldwide and Pratt Marketing do some amazing work, and we're wonderful that you're part of the Chamber as well. And I want to thank Myra Bennett, our producer at the Chamber, for helping coordinate all the logistics with the podcast, and very grateful for that. Tune in. We're going to continue to work to bring fascinating stories. Today is a perfect example of that. If you have questions, we're open to answer. Go to scottsdalechamber.com if you want to learn more about the Chamber or the programs and events coming up. But most of all, just thanks for being members of the Chamber, and thanks for
you.
joining me today.
Thank you.
Thank you for having
Mark.
us.
You're welcome.